Every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those devastating words. And for some of them, the cause was never their age, their genetics, or an inevitable decline. It was a simple bottle sitting on the bathroom shelf that they were promised was completely safe, rigorously tested, and entirely harmless. I am Dr. Harold Meyers, and over 15 years of medical practice, I have watched this exact tragic picture play out more times than I can count. Someone who has been sharp, witty, and deeply independent their whole life suddenly starts losing the thread. They forget names, miss appointments, and lose their way on the drive home they have made 1,000 times before. Everyone around them sighs, shakes their heads, and calls it getting old. But it wasn't old age. It was a medication. It was an everyday chemical almost nobody thinks to question because a licensed doctor prescribed it, a trusted pharmacy filled it, and a giant pharmaceutical company marketed it as a standard solution to an everyday problem. Here is what the newest, most rigorous medical research keeps showing us. One ordinary, everyday class of drug can pull your memory, your processing speed, and your ability to learn down hard inside a single year. And the most terrifying part is that the vast majority of people taking it have absolutely no idea it is happening to them. Today, I am walking you through the 9 medications most closely tied to rapid drug-induced memory loss. We are going to count them down together, moving from the ones that get quietly overlooked every single day to the one single phenomenon I consider the most destructive of all. Watch out specifically for number 3 on this list. It is handed out to millions of seniors every year for something that sounds completely harmless, and it may be actively shrinking the memory centers of your brain right now without giving you a single warning sign until the damage is already done. Before we dive into the countdown, do me a quick favor and tell me in the comments below how old you are and which specific medications you take every single day. I personally read through these comments, and the age and experiences of this audience directly shape the medical topics and deep dives I cover in my next videos. Let us start at number 9 on our countdown, and please do not let the low spot on the list fool you because this specific drug is sitting in almost every single medicine cabinet in America right now. Number 9 is diphenhydramine. You almost certainly know it by its famous drugstore brand name, Benadryl. It is the little pink pill that millions of people reach for every night to fall asleep, to calm a sudden allergy flare-up, or to take the miserable edge off a nasty cold. It costs a few dollars, it sits on an open, unregulated shelf, and most people assume that because nobody needs a formal prescription to buy it, it must be completely gentle and safe. But inside your brain, it is doing something very different and highly disruptive. Diphenhydramine belongs to a powerful group of drugs called anticholinergics. That is a long, intimidating medical word for a very simple and dangerous idea. These drugs actively block a vital brain chemical called acetylcholine. Acetylcholine is the fundamental chemical messenger that your brain uses to lay down a brand new memory, connect thoughts, and stay sharp and alert throughout the day. As we age, the human brain naturally makes less of this chemical and begins to lean much harder on every single bit it has left. Because of this, a drug that forcefully blocks acetylcholine lands far heavier and does significantly more damage to a 70-year-old brain than it ever would to a 30-year-old one. The specific part of your anatomy that takes the direct hit is the hippocampus, that small, fragile, seahorse-shaped structure deep in the temporal lobe where new memories are formed and processed before they get permanently filed away. In my own medical practice, I have watched patients take a nightly over-the-counter antihistamine for years, slowly losing their cognitive edge, becoming increasingly confused, and never once connecting that growing mental fog to the little pink pill sitting right by their bed. But the clinical research connects it very plainly. A landmark 2023 paper published in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a staggering 54% higher risk of developing full-blown dementia compared with people who stayed completely off them. That is more than half again the normal baseline risk, all from a tiny over-the-counter pill that most of us treat like harmless candy. Here is exactly what you need to do this week. Read the fine print on the ingredient label of absolutely anything you take to fall asleep, and look closely at anything explicitly marked as PM, nighttime, or allergy relief, because those products are very often just diphenhydramine wearing a different brand name and a different marketing jacket. If you take it regularly for seasonal allergies, please know that there are newer, vastly safer antihistamines available today, like loratadine, which is sold commonly as Claritin. These newer options do not cross through the blood-brain barrier into your delicate brain tissue the way Benadryl does, making them far safer for the long haul. Remember, you should never abruptly stop a prescribed medication entirely on your own without professional guidance, but you must bring this up to your doctor and immediately stop assuming that over-the-counter status means safe for your memory. That brings us to number 8 on our list, which is a medication that your stomach absolutely loves, but your brain quietly and severely pays for over time. Number 8 is the class of drugs known as proton pump inhibitors, or PPIs. The massive household names here are omeprazole, sold as Prilosec, and esomeprazole, commonly sold as Nexium. These medications are designed to completely shut down acid production in the stomach, and they get handed out like water for heartburn, acid reflux, GERD, and that painful burning feeling people experience after heavy meals. Because the moment people try to stop taking them, their painful symptoms come roaring back worse than before. Patients end up staying on them for years, sometimes even decades. It feels to the patient like the drug is the only thing holding the line against agony. But here is the critical part that almost nobody ever hears at the pharmacy counter while picking up their refill. Your stomach desperately needs natural acid to pull essential nutrients out of the food you eat. Chief among these vital nutrients is vitamin B12, a compound that directly protects, insulates, and maintains the complex electrical wiring of your nerves and your brain cells. Turn that stomach acid down far enough and long enough, and your body's B12 levels will quietly and drastically drop. Along with it, you lose your ability to properly absorb magnesium and calcium, two fundamental minerals that your brain cells absolutely depend on to fire signals cleanly and talk to one another. If you starve your neurons of these crucial building blocks, you get frequent misfires, sudden confusion, and noticeable memory slips that look exactly like the early stages of Alzheimer's disease, when the real underlying cause is a severe nutrient deficiency that your daily medication has been blocking for years. In 2016, a massive, rigorous study published in JAMA Neurology examined more than 73,000 individuals aged 75 and older. They discovered that regular, long-term PPI users had a shocking 44% higher risk of dementia than people who did not take them. The trouble actually runs even deeper than simple nutrient malabsorption, because PPIs have also been shown in laboratory studies to raise the absolute levels of amyloid beta inside the brain tissue itself. Amyloid beta is the sticky, abnormal protein that clumps together to form the destructive plaques characteristic of Alzheimer's disease. So here is the smart move if you find yourself taking a PPI every single day. This is the exact conversation you need to initiate with your healthcare provider as soon as possible. Many people can easily and safely taper down onto a much gentler class of stomach medications called H2 blockers, such as famotidine, which is sold under the name Pepcid. This class of drug is far less likely to touch your cognitive thinking or interfere with your brain chemistry. Additionally, chewing deglycyrrhizinated licorice, a completely natural herbal compound often called DGL, can beautifully coat, soothe, and calm your stomach lining with zero negative cost to your brain power. The ultimate medical goal should always be the lowest effective dose for the shortest possible time, not a powerful pill you take forever out of sheer habit. Moving along to number 7 on our countdown, we find a drug that is prescribed for a frustrating physical problem that most seniors would understandably rather not talk about in public. Number 7 is the class of bladder medications, and the specific one you absolutely need to know by name is oxybutynin, frequently sold as Ditropan. This drug is commonly given to seniors who deal with a sudden, urgent, and uncontrollable need to get to the bathroom immediately, the kind of severe, overactive bladder that can completely reshape a person's entire day, trapping them in their home. The physical relief this medication provides is very real, and the intense social embarrassment it spares people is real too. But oxybutynin works by aggressively blocking acetylcholine, the exact same vital memory chemical that Benadryl blocks. To make matters worse, this specific drug slips across the protective blood-brain barrier very easily and parks itself right in the structures where human memories are made and stored. That specific characteristic makes it one of the most dangerous and toxic medications on this entire list for an older adult, especially when it is taken month after month, year after year. In 2019, the prestigious British medical journal published a massive study tracking people over the age of 65 who took strong anticholinergic bladder medications like oxybutynin for more than a single year. Their statistical risk of developing full-blown dementia was a terrifying 49% higher, which translates to nearly a 1 in 2 additional chance. What troubles me most as a physician is that almost none of these patients were ever warned about this when given the prescription. They were told a simple pill would calm their overactive bladder, but nobody mentioned that it might be quietly dimming their mind and erasing their memories at the exact same time. The resulting mental fog almost always gets blamed entirely on old age. People describe forgetting important appointments, losing their keys 10 times a day, or completely dropping the thread of a simple conversation with their grandchildren, and everyone around them simply nods their heads and says, "Well, you are just getting older." It is rarely traced back to the prescription pad until real, irreversible cognitive ground has already been lost. If you are taking oxybutynin right now and you have noticed your memory slipping or a persistent mental fog creeping in, I need you to take that sign very seriously. You do not have to make a tragic choice between your physical bladder control and your brain health. Newer, advanced medications like mirabegron, sold under the brand name Mirbatric, work through a completely different physiological pathway in the body and do not block acetylcholine in the brain at all. For the vast majority of older adults, these modern alternatives provide the exact same physical bladder control with drastically less risk to your long-term thinking skills. Please bring this up explicitly at your very next doctor's visit. Number 6 on our list might be the single most surprising and controversial entry here, because it happens to be one of the most widely prescribed classes of medication on the entire planet. Number 6 is statins. Specifically, medications like simvastatin and atorvastatin, which you probably know by their massive brand names Zocor and Lipitor. These drugs are prescribed to hundreds of millions of people worldwide, especially after they cross the age of 60, and they do an incredibly important job of lowering circulating LDL cholesterol, thereby cutting the risk of cardiovascular heart attacks and strokes. Statins absolutely belong in a lot of people's lives, and I want to be perfectly clear that this is not a blind case against them. However, what follows is the crucial half of the medical story that usually gets left out of the conversation entirely. Cholesterol does far more than just affect your cardiovascular heart and arteries. Your brain is actually composed of close to 60% pure fat, and it actively uses cholesterol as a fundamental building block to manufacture the myelin sheath. The myelin sheath is the thick, vital insulation wrapped securely around every single nerve cell and pathway in your nervous system, ensuring that electrical signals travel fast, clean, and uninterrupted. If you aggressively lower your cholesterol levels hard enough and fast enough with a highly potent statin, you can easily leave your brain desperately short of a raw material it fundamentally needs to maintain its structural wiring. The specific statins that cause the most severe cognitive trouble are the ones categorized as lipophilic, meaning they cross easily into lipid-rich brain tissue. In 2023, a telling study published in Frontiers in Aging Neuroscience found that adults over the age of 70 who had been on daily statins for more than 3 years showed a 26% higher rate of developing mild cognitive impairment. And the researchers noted that the higher the daily dose was, the steeper the cognitive slide became. Some patients on these high-dose regimens have described frightening, sudden mental blanks, a familiar friend's name completely gone, a conversation they literally just finished being completely erased from their mind, or a physical route they have driven for 20 years suddenly looking entirely unfamiliar. The critically important thing for you to understand is that not every single statin touches the brain in the exact same way. Hydrophilic statins like pravastatin and rosuvastatin do not cross into delicate brain tissue nearly as readily, and because of this molecular difference, they are generally considered the significantly safer choices for maintaining clear thinking and memory. So, if you have been on a daily statin for years and you are starting to notice a persistent fog, increasing forgetfulness, or unusual confusion creeping into your daily life, that is a real, urgent conversation to have with your doctor. You can look into a lower dose or a smart switch to a hydrophilic alternative. It is absolutely not a reason to quietly quit a drug on your own that may be actively protecting your heart. Get the medical plan right with professional help, never ever on your own. Let us take a quick pause right here. If this information is helping you connect the dots and making sense of things you or a loved one have been experiencing, please take just 1 second to tap that like button right now. It genuinely helps this video bypass the algorithms and reach more seniors who desperately need to hear this warning before it is too late. And while you are down there, tell me exactly how many different prescription pills you are taking right now. As I said, I read these comments closely. All right, let us get straight back to the countdown with number 5 on our list. Number 5 is the class of drugs known as benzodiazepines. The major names here are lorazepam, sold as Ativan, diazepam, sold as Valium, and alprazolam, famously known as Xanax. These are among the most heavily prescribed psychiatric drugs in the entire country for chronic anxiety, panic attacks, and severe insomnia. They work by powerfully boosting GABA, which is the brain's own natural calming neurotransmitter that turns down a racing, overstimulated, and stressed nervous system. At first, when a patient takes them, they feel like an absolute rescue. The intense panic immediately eases, the spinning thoughts finally stop, and deeply desired sleep comes quickly. But over time, the long-term chemical picture changes dramatically. A massive 2022 study published in the British Medical Journal followed more than 8,000 seniors over a span of 6 years and discovered that those who used benzodiazepines for longer than just 3 short months had a shocking 51% higher risk of developing irreversible Alzheimer's disease. The longer-acting variants of these drugs, like diazepam, were found to be the worst offenders because they linger in the human body for days and continuously build up in fatty tissues, including the brain. What the drug is actually doing over months and years is a slow, continuous chemical sedation of the entire central nervous system. Under this constant sedation, the brain learns new things much more slowly, it grows significantly less structurally flexible, and many patients describe a profound mental flatness, a constant sense of moving through a thick fog and a feeling of not quite being themselves anymore. The absolute cruelest part of this class of drug is the exit. If you stop taking a benzodiazepine abruptly on your own, the underlying anxiety and insomnia come roaring back twice as hard as before, accompanied by a physical agitation and withdrawal symptoms that can be genuinely life-threatening. This severe rebound effect makes the patient believe that the pill is absolutely essential for their survival, right when the pill is actually doing the most profound cognitive harm to their brain. So here is the medical rule, and it matters immensely. If you have been taking a benzodiazepine for more than a few weeks, do not ever stop taking it suddenly. You must work hand in hand with a knowledgeable doctor to taper down your dosage incredibly slowly over a period of weeks or even months. Far gentler and safer medical options exist today, such as buspirone for anxiety, which does not sedate the brain or cloud your thinking processes at all. For sleep issues, there is a specialized form of talk therapy built specifically for insomnia called CBTI that helps bring natural calm back to your nights without any cognitive cost to your days. That brings us to number 4, a single pill that is frequently prescribed for 3 completely different medical problems, and because of that, it carries one of the heaviest hidden burdens of all. Number 4 is amitriptyline, commonly sold as Elavil. This is an older tricyclic antidepressant that is still handed out constantly today, not just for mood, but for chronic nerve pain, for sleep, and even to head off severe migraine headaches. That exact medical versatility is precisely why it spreads so quietly and dangerously through the senior population. It looks to the patient and the busy doctor like a wonderful do-everything pill. But underneath that convenient exterior, it is actually one of the most powerful and aggressive anticholinergic drugs still in wide clinical use today. This means it blocks acetylcholine with incredible force, disrupting the very chemical your neurons completely rely on to talk to each other and lock in new memories. It blocks this system so strongly that with long-term use, the negative effect on human memory stops being a rare, accidental side effect and instead becomes the statistically expected result. In 2015, a large, well-funded study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. The researchers discovered that those individuals who took the highest cumulative dose of anticholinergic drugs, like amitriptyline, over a 10-year period, had a horrific 54% greater chance of developing full dementia. And once again, almost none of them were ever warned about this outcome. They originally got the pill for a completely unrelated issue like chronic back pain or insomnia, then slowly noticed words going missing from their vocabulary, their short-term memory thinning out, and their daily concentration fraying, and they simply chalked it all up to getting old. It does not even take a massive dose to cause this. A relatively small, modest nightly dose taken consistently for years can quietly and steadily erode your total brain power with no obvious initial symptoms until the cognitive loss becomes profound and real. If you or someone you love is currently taking amitriptyline, this is a conversation that is absolutely worth having with a doctor very soon. For chronic nerve pain, modern options like duloxetine or gabapentin can often provide similar or superior physical relief without carrying that massive, destructive anticholinergic weight. For sleep issues, natural melatonin or an incredibly low dose of a gentler drug like doxepin can safely take its place. And for managing mood, newer classes of antidepressants like sertraline or escitalopram are considered vastly safer for the long-term structural health of your brain. Now let us talk about number 3 on our list. This is the one I specifically told you to watch out for at the beginning because it is handed out to millions of people for something that sounds completely harmless on the surface. Number 3 is paroxetine, widely sold under the brand name Paxil. This is one of the most heavily prescribed members of a family of modern antidepressants called SSRIs, used extensively to treat depression, generalized anxiety, and panic disorders. On the surface, it looks to the patient like a modern, gentle, and safe option, supposedly much kinder to the body than the old generation of psychiatric drugs. But here is the critical hidden detail that pharmaceutical advertisements and busy clinics rarely mention. Paroxetine is the one single SSRI that possesses incredibly strong accidental anticholinergic activity. This single pharmacological fact completely sets it apart from its safer siblings like sertraline and escitalopram, because it reaches deep into the exact same vulnerable acetylcholine system that every other dangerous drug on this list has been chipping away at. In 2021, a large, comprehensive medical review published in Frontiers in Psychiatry looked specifically at older adults taking different SSRIs and found that paroxetine users showed measurable, significant drops in short-term memory, word recall, and spatial attention within the first 12 months of starting the drug.